the Cork Dental Hospital started in 1913 with its first intake of 2 students, in fact. And it was set up essentially by Sir Bertram Windle, who came over from Birmingham to be president of UCC. And it was actually a small dental school to start with, but probably more of a dental hospital than anything else, that people served a type of apprenticeship, if you will, to actually get a dental training. Because at that time, there was a process of trying to professionalize training of dentists rather than an apprenticeship model that used to happen before. And I suppose over the next 30 to 40 years, it was run out of the North Charitable Infirmary Hospital on the north side of the city as a service to the community, in essence. And gradually, students did get trained in very small numbers initially, 2, 3, 4 students per year, moving up to around about 10 to 12 students a year in the 1940s. And this progressed on through the 50s and into the 60s, when eventually UCC took over the running of the dental school full-time, 100%. And the link then, in essence, with the North Charitable Infirmary was broken, other than it was physically located there. And then over the next 20 or so years, there was a move out to this location in Wilton. It was a little bit difficult because it took a while to get full approval at government level to set up another dental hospital facility in Cork. But it's been in this location now since 1982, run by University College Cork completely. And we are now in our 100th year. So we're up to around about 250 students in total now, studying dentistry and dental hygiene as well. And we have about 30 to 35 dental nursing students per year. So it has expanded hugely in that 100 years. The dental hospital, it was rooted originally in a service to the community. That has been a major part of the mission of this facility and this organisation. And that's how it started. It was a service to the community, and where people were trained into becoming dentists and graduating from university. And that has grown substantially over the 100 or so years. Now we have an organisation which is rooted in 3 major areas: teaching, education and research, and service to the community. And they're all interlinked. And to give you an idea of scale, we have about 60,000 patient visits through this hospital every single year. And all of those patients are treated by either students doing their training at undergraduate or postgraduate level, or indeed specialist clinicians on the staff who are also involved in teaching and training of dental students. We're very proud, I suppose, of the way the attractiveness of our course continues to be very strong, and again it's growing. Each year the top 2% of school leavers are entrance into dental school from the Irish school leaving system, and we have very strong international application record for our programme from North America, including USA and Canada, from the Far East and Malaysia, from countries in the Middle East. So we have a huge interest in that, and approximately 30% of our students now are international students, numbering 70 to 80 students in a given period of time across the 5 years of the programme. So it's very strong interest and oversubscribed hugely, and it's a great sign of the quality of the programme that there's such interest in it both nationally and internationally. One of our colleagues, Professor Helen Welton, is taking over as the president of the International Association for Dental Research. So we're on an upward trajectory in terms of research performance and research output, and a number of other colleagues are performing very well in that area. Our publication record in high impact journals in dentistry is actually very good at the present time. So we're very happy about that as well. So we're getting consistency of quality in both teaching and research. But at the same time, that service to the community, which is what founded all of this in the first place, is still very strong. And beside that then, there is a strong research ethos, which is growing year on year, and it's marked now by significant international success in a number of areas, such as fluoride research, population health research, geriatric oral health research. So it really has grown hugely in scale over that 100 years. 100 years is obviously a very significant event. It's not many dental schools have reached that internationally. So we are out there as one of the longest established dental schools now in Western Europe. So we do plan to mark it with a number of events, starting with the centenary conference in the beginning of March. And we're going to have an alumni dinner. We have about 350 booked guests for that from all over the world, graduates from the dental school in UCC. And that'll be, the conference will follow on from that, and we have speakers lined up who are actually, again, graduates of UCC who have achieved internationally in a number of areas. For example, the Chief Dental Officer for Canada is a Cork graduate, and he is going to be one of our speakers at that conference. We're also doing a history, which documents a lot of the social history of Cork, as well as the history of this dental school and hospital. And that will be launched later on in the year. And there are other events, such as we're hosting the Irish International Association for Dental Research Conference in Cork later on in the summer under the presidency of one of my colleagues, Dr. Mairead Harding. So there are a number of events we're using to mark this occasion.